What if your body isn't broken? What if it's simply asking for something different? Hi, I'm Cristina Clark. If you've been told your symptoms are just part of getting older, you're in the right place.
Hello, Dr. Ovadia. How are you today? I'm so excited to have you here.
Thank you, Cristina. I am doing excellent. It is great to see you and excited to have a great conversation with you and your audience.
First, let me say that I am so excited to have you here on the podcast. I actually met you about just over 7 months ago. And so this has been 7 months in the making, talking to Kelly behind the scenes. And we met at Hack Your Health in Tampa. I had never been to that event. And when I saw you there, I was like, I'm going to talk to him. This is so exciting. And I'm really just so impressed with your expertise, your personal story, and you've written 2 books. So could you tell us who you are, what you do, and why we should listen to you?
Thank you, Cristina. Yeah, it's been an exciting 7 months or so since Hack Your Health, a great conference. Hope I'm going to see you there again this year upcoming. Looking forward to that. So I have been a cardiac surgeon, a heart surgeon for 25 years now. And for much of that time, I was a very unhealthy heart surgeon. 10 years ago, I was morbidly obese. I was pre-diabetic. And I came to a realization that I was going to end up on my own operating table, so to speak. And the second important realization was I didn't know what to do about it. The advice that I had been educated to give people, and it's the advice that many in your audience will have heard, right? Eat less, move more, eat a low-fat diet, follow what was the food pyramid at the time, wasn't working for me, wasn't working for my patients. And that, kind of got me thinking about things a little bit differently, asking some different questions, kind of became open to some different information, I would say. And ultimately, I first was able to improve my own health. I lost nearly 100 pounds, reversed my pre-diabetes, and I did that following a low carb diet. And then that led me to ask some more questions about heart disease, right? The disease that I had dedicated my career to fighting against. And I came to realize that, again, what I had been educated was not quite the whole story. And so increasingly, I have become focused now on keeping people off the operating table, helping them to avoid the need for heart surgery and stents. And that led to my first book, Stay Off My Operating Table. Came out about 5 or 6 years ago, award-winning, did very well. And then just as we're recording this 1 week ago, I released my second book, Stay Off My Kitchen Table. Very excited to announce as of yesterday, it has hit the New York Times bestseller list. And so that's doing very well. And like I said, along the way, I've now established a nationwide telemedicine practice that I work with people on preventing and treating heart disease. But, again, trying to reverse and prevent heart disease, something that honestly, again, I didn't really even know was possible under my traditional sort of training and the traditional approach to heart disease. So, in the end, I've seen what this disease is, right? I see the people who, need my services as a cardiac surgeon. And I realize that for the vast majority of them, they shouldn't be there. They shouldn't need to be there. I now view every patient that ends up on my operating table as a failure, but not that the patient has failed, that the system has failed the patient, because heart disease is largely preventable and we are just focused on the wrong things, and therefore we are doing a lousy job at preventing it. We do a pretty good job at treating it these days, but we do a lousy job at preventing it. And that's ultimately the problem that we need to solve.
I have so many questions. I actually recently went to the cardiologist to see if I had any issues with my heart. And the first thing they wanted to give me was statins. And when they found out I was allergic to everything, they were like, oh, you probably can't take those, but we have injections now. And I was like, well, let's get my CAC and my echocardiogram back first. And he goes, well, if you're not going to do what I ask you to, then I'm not going to be able to order your CAC. And I was like, we haven't gotten that far yet. Let's work on that. So, what's actually clogging the arteries? Is it the meat and the butter and the salt that we hear that carnivores say are good for us? Or is it actually the standard American diet and all those prepackaged foods in the store that have that heart healthy symbol on them?
Yeah. So it is not the meat and the butter and the foods that we have been eating as human beings for our entire existence as human beings, right? And when you really step back and think of it in that light, it would make no sense that the food that we evolved eating, the food that literally allowed us to evolve as human beings, would be harmful to us. The science, right? The studies that led to this concept that red meat is bad for our health and that red meat is bad for our heart health in particular, they're a combination of poorly done and in some cases outright fraudulent science. And it never was true and it never will be true. And it doesn't matter how often the lie at this point gets repeated, it's still not the truth. And so obviously those of us in the carnivore community have figured that out. I now, as a heart surgeon, say that meat is medicine, because not only is meat not harmful to our health, meat is essential to our health. And this is a lot of what I talk about in Stay Off My Kitchen Table. And what people need to understand is that doctors get very limited information, right? Necessarily so, right? There's no way that anyone studying to be a doctor, anyone who is a doctor trying to keep up, right, can truly consume all of the information that's out there, even if you narrow it down to just say heart disease, right? Heart disease is an incredibly complex topic. And, so it by necessity has to be filtered. And unfortunately, that filtering is where we run into a lot of the problems, because I was educated to believe that cholesterol was the cause of heart disease. The dietary cholesterol that we ate, which then resulted in the blood cholesterol levels, which then turned into the cholesterol that appears in the plaque within the arteries that lead to atherosclerotic heart disease, the most common form of heart disease. And I understand, right? Makes perfect sense, right? You look, right? We go back to how this all began, right? People die of heart disease. They have an autopsy. The pathologist, right, looks in their blood vessels, sees this substance, right? And under the microscope, they identify this is cholesterol. And then we take samples of blood from people and we see, oh, there's cholesterol in the blood, right? And then we look at foods and we say, well, there's cholesterol in food. So, obviously, you eat the cholesterol, it goes into your bloodstream, it ends up in your arteries. And it makes perfect sense. And the problem is it's just not true. No part of that, right? It turns out that the cholesterol that we eat has very little to do with how much cholesterol ends up in our blood. It turns out that having cholesterol in our blood doesn't necessarily mean that cholesterol ends up in our blood vessel walls as plaque. There's a couple of steps in there that become very important. And so the diet heart hypothesis, as it's been known, has been the prevailing hypothesis around heart disease for 70 years. And we've followed it, right? Because the natural conclusion is, okay, eat less cholesterol and then reduce the amount of cholesterol in your blood. And that's where the pharmaceuticals come into play. And the problem is that we've been doing both of those in increasing amounts. We eat less cholesterol these days, and specifically we eat less red meat these days than any time that we've been recording this over the past 60 or 70 years. And more people take the medication, and our blood cholesterol levels as a population are the lowest they've ever been. And yet heart disease is getting worse. It is still far and away the number one killer every year here in the United States and worldwide, and it is getting worse. So obviously that tells us something must be wrong with our theory, but the mainstream system is so fixated on this theory that they just, at this point, can't see what else is out there. And the average doctor just has no idea, right? They've just been told that the best and the only thing that you can do to help your patient prevent heart disease is lower their cholesterol. So that's why you get a response like you got from your doctor of, well, if you're not going to do this, then there's really nothing else I can do for you. So, I'm not going to be your doctor, right? Because that's pretty disempowering as a doctor if you have nothing to offer the patient, essentially. But for you as the patient, right, the problem is that doctor has failed you because heart disease is not all about cholesterol. Cholesterol might play a minor role in it, and we'll get into all of that. But there's lots that we can do beyond lowering cholesterol. There's lots that we can do that is much more effective and better than just lowering cholesterol. And the sad thing is that most doctors don't know about it, and therefore most patients don't get to hear about it.
So don't we actually need cholesterol? Isn't it part of the system that we have in our body?
Yeah, I mean, cholesterol is essential to life. It is literally the structure, right, of our cells that make us, right? We would not exist without cholesterol, and nothing in this world would exist, right? Without cholesterol. So yes, cholesterol is essential. And no, cholesterol does not exist just to cause heart disease, right? Cholesterol serves many important roles in our body. Besides the structural aspect of it, it is the precursor for many of the essential hormones, things like testosterone, progesterone, estrogen, right? All get made from cholesterol. Vitamin D gets made from cholesterol. Cholesterol plays a very important role in our immune system. And that becomes very important when you start talking about lowering cholesterol levels to astronomically low levels that are possible these days with some of these pharmaceuticals. And lo and behold, when you do that, you start seeing more patients dying of things like infections and cancer. And so again, maybe, lowering cholesterol isn't the right thing and is going to have unintended consequences that we end up seeing.
Yes, I agree with that. So what clogs arteries then? And how does that happen?
Yeah, so it is plaque, right? And it is plaque that is made up of cholesterol. But here's the problem. In order for that plaque to form, you first need to damage the blood vessel wall. And so we should start by asking, well, what causes the damage? And these are things like high blood sugar, directly damaging to the blood vessel wall. Inflammation that can come from lots of different places, damaging to the blood vessel wall. And then, in order for the cholesterol, which comes along to try and repair the damage to the blood vessel wall, in order for it to kind of get stuck there and start building up the plaque, the cholesterol itself needs to be dysfunctional. Right. And this is where we get into quality of cholesterol as an important metric, right? An important thing that we can measure regarding our risk of disease. But, when we're talking about LDL cholesterol, right? And we're talking about the particles of LDL, low density lipoproteins, that transport cholesterol around in our bloodstream. And those particles can come in different sizes, right? They can be small, dense particles, and they can be large, fluffy particles, broadly speaking. There's stuff in between, but we usually kind of break it down into those two categories. And it turns out that it's only the small, dense particles that are what we call atherogenic. They, because they are dysfunctional, when they go to repair the damage in the blood vessel wall, they set off their own inflammatory immune reaction. And that is what causes the plaque to build up. The large fluffy particles, those come to repair the damage. They take care of the damage and they disappear because they're working as they should. So again, it's the right question to be asking isn't how much cholesterol do I have in my bloodstream? It's what types of cholesterol do I have? What is the quality of the cholesterol that I have? And why do I have that quality of cholesterol, those types of particles? And that's what really gets us to the true root causes of heart disease. And that leads us back to things like insulin resistance and inflammation, which of course leads us back to diet and lifestyle as a way to counteract that.
Yes. So can clogged arteries be reversed? or improved?
Yes, plaque can lessen. And I see this now on a regular basis in my practice. And we can talk about the different types of plaque, right? We talk about calcified plaque versus soft plaque and the different ways to look at that plaque. And that's going to be an important part of our discussion. But ultimately, I have seen both types of plaque reduce in patients who address the root cause, who address the insulin resistance, address the inflammation, improve the quality of their cholesterol, and then the body can start to heal. Our bodies have an amazing capacity to heal, right? And we see this all of the time. But in order for a body to heal, you need to stop doing the damage. Right? That's the first step in getting healing. And unfortunately, when it comes to cardiovascular disease, most people out there are constantly doing damage because they are insulin resistant, because they are eating, highly processed carbohydrates and highly processed fats like vegetable and seed oils, right? They're doing constant damage to their blood vessels. And then you add on top things like smoking or, not getting enough sleep, being under, significant stress all the time. And these things just compound those problems even further.
Yes. So I have so many questions. Were we lied to about carbs being healthy and necessary? And the people that have the most disease, like I see family members with disease and I'm looking at them going, probably those carbs, but they do not want to hear that. So could you answer that if that made sense? And then I'm going to go to the next question.
Yeah, so I think there's a little bit of nuance in this discussion, right? And that comes from this. If you are insulin resistant, you are intolerant of carbohydrates, and you're intolerant of carbohydrates of all kinds. Doesn't matter if it's the piece of fruit or it's the candy bar. Your body is struggling to process that and can't keep up with processing that no matter what it's coming from. Now, understand that the vast majority of people walking around today are insulin resistant. The statistics have shown us upwards of 93% of the adults in the United States have some evidence of metabolic disease, some evidence of insulin resistance or impaired insulin sensitivity. So you kind of have to assume you are, unless you've really done the testing to prove that you're not. Now, do I believe that it's the carbohydrates and only the carbohydrates that have caused the problem in the first place? I would say not necessarily. There are carbohydrates that if you are not insulin resistant, you can tolerate them. They're not going to be harmful for your health, right? Things like fruit, things like non-processed carbohydrates. They are not essential to your health. You don't need them. They're not providing you any unique benefit, and they're not providing any, mineral, nutrient, vitamin that you can't get from red meat. But some people can tolerate some carbohydrates. Now, the problem we've gotten into is most of the carbohydrate that's consumed is highly processed, and it's combined with things like vegetable and seed oils. And those vegetable and seed oils at a biochemical level damage our mitochondria and can lead to the insulin resistance that then makes us intolerant of carbohydrates. So, the honest truth is, yes, you can get into some nuanced discussions about, is it the carbohydrates? Is it only the highly processed carbohydrates? Is it only when we combine them with vegetable and seed oils? But in the end, being the simple surgeon that I am and wanting to explain this simply to people, I just say avoid the processed food and avoid carbohydrates because they're not providing you any unique benefit. They are not essential in any way. And eat the most nutrient dense, most bioavailable food that we have as human beings. And that is ruminant animal meat, the protein and the fat that comes with it. And that is how we get to optimal health.
Yes. Next question is natural sugar versus processed sugar. People will argue with you that the body knows the difference. Is that true?
Maybe in some, small way, but the practical answer is no. It doesn't make a difference. And again, this gets back to, are you already insulin resistant? In which case, your body can't process sugar, whether it's, the the natural sugar in honey or a piece of fruit, or it's the, more processed sugar in the cake and the candy. They're both going to be problematic to someone that's insulin resistant. Now, again, if we're dealing with the person who is not insulin resistant, yeah, I'd much rather them have the natural sugar in something like honey or a piece of fruit than the highly processed sugar that's combined then with usually highly processed oils and the other highly processed carbohydrates that become so problematic.
Insulin resistance, you mentioned this, but I just sort of wanted to dig there for a minute. Insulin resistance or inflammation? Which one's actually the root problem, and how do heart health and blood sugar correlate?
Yeah, so they both can be root cause problems. I operate on patients, occasionally who are not insulin resistant, but they have an inflammatory condition like, arthritis, rheumatoid or psoriatic arthritis, right? And that inflammation over the years has contributed to their blood vessels being damaged. Insulin resistance is way more common in terms of the cause of cardiovascular disease. And, we have science, we have data going back to the 1970s that show us that 95% of patients coming into the hospitals with heart disease, with heart attacks, are insulin resistant if you test for it in the right way. Now, we don't test for it in the right way largely, and that's why heart disease builds undetected for so long until it becomes kind of clinically apparent. But if you start testing for insulin resistance and you start looking for the heart disease at its earlier stages, that's where I believe we have such a huge opportunity to, keep most people from getting to the point that they have a heart attack or they need to come see me as a heart surgeon.
Now, are there tests or scans like Lifeline screening that people can do to find out before it's too late?
Yeah. So the first one is the one that you were asking your doctor for, the coronary artery calcium scan. This is the best screening test that we have when it comes to heart disease. Now, it's only a screening test. It may not be the definitive test, right? It's only showing us the calcified plaque in the arteries of your heart. But it is a inexpensive scan, usually around $100 here in the US. It is low radiation exposure, and it is a very easy test to do. They don't have to put an IV in you. It literally takes, 2 minutes. You lay down on the CAT scan table, they put you in the machine, they pull you right out of the machine, and we can now see, do you have calcified plaque in the arteries of your heart? And, you'll hear many people argue against the calcium scan because it only picks up the calcified plaque. And that is a little bit of a limitation, but the practical reality is if you have zero calcified plaque, the chances of you having enough of the non-calcified plaque that it's going to be problematic is exceedingly low. And the chances of you having a heart attack, if you have a 0 CAC score over the next 5 years or so, is very, very low. So now the thing to understand about the calcium scan is it's not a one-time test. You need to repeat it. You need to follow it over time. If your score is 0, you need to make sure it's staying 0 over time. It's not a lifetime guarantee. If your score is not 0, you want to understand, is the disease progressing or not? And, people should be asking that question. Whatever doctor you choose to go to, right, to deal with your heart disease, if you get a CAC scan and it's not 0, and, you can go the mainstream way and go take the medications, right? You can come listen to someone like myself and address things through diet and lifestyle. But you need to prove to yourself, and they need to prove to you, that what you're doing is working. And what that means is that that score stops going up. Ideally, we get that score to even go down some. But as long as it stops going up, that's a marker of success. So the calcium score is your screening test, and you can use it serially over time to follow things along. The more advanced scan is called the coronary CT angiogram. This test shows us all of the plaque, shows us the calcified plaque, shows us the non-calcified plaque, allows us to measure exactly how much narrowing, or what we call stenosis, blockage, is in the arteries because of that plaque. And, it gives us a lot more detail. Now, the trade-off is it's a more complicated test. We do have to put an IV in you. We need to give you contrast dye through that IV. The scan involves a higher exposure to radiation. It's more expensive. And so those are the practical trade-offs that we have to make. But either way, there is no excuse today, in my mind, for someone to show up with sudden, unexpected heart disease, right? To find out the first time that they have heart disease is when they have the heart attack, because we can get these tests and we can see the disease. And there is no reason that we shouldn't be using these tests to look through the disease. But again, the mainstream approach to heart disease is, first of all, we think that the blood test, right, the cholesterol, is a marker of the disease. It is not. It does not tell you anything that is going on in the arteries of your heart. You can have high cholesterol with no plaque. You can have low cholesterol with lots of plaque, and, all the combinations in between. The disease is the plaque, and we should be measuring and looking at the plaque. So if nothing else, I tell people, right, go get the scan. Go get screened for the disease. Men, by the time you're 40, women, by the time you're 50, you should have that first CAC scan. If you know you're insulin resistant, if you've been a smoker, if you have inflammation that you know about chronically, go get that scan earlier, because the unfortunate reality that I see today as a heart surgeon is I used to operate on 70 and 80-year-olds, maybe some 60-year-olds and an occasional 50-year-old. I today routinely operate on 40-year-olds, and I even see 30-year-olds ending up on my operating table. So it's really never too early at this point to get that first scan. And if it's 0, great. And understand, the younger you are, the more likely it is that your CAC score is going to be 0. And like I said, it's not a lifetime guarantee, but if it's not 0 and you're very young, that should be a major red flag. So go get the scan so do you need to worry about this or not?
Okay. So many things came up. So someone I know has a 250 for their CAC score. Mm-hmm. And I also heard of a carnivore or a low carb person who had a 0 CAC and they had a heart attack. Yeah. What's your take on it?
Yeah. So the person with the 0 CAC score that has a heart attack, whether they're carnivore or, not. The reason this happens is because not all heart attacks are caused by plaque. Blood clotting is an important part of what leads to heart disease. And if lots of things, right, can lead to blood clotting. And we know that even things like, being under a lot of stress can predispose you, getting dehydrated, there are lots of things, right? There might be some, I'll say this in a very careful way, there might be some therapeutic agents that were recently introduced to us under emergency circumstances that seem to increase blood clotting that coincided with what seemed to be a noticeable increase in young people showing up with heart attacks. So things like that can cause blood clotting, can cause a heart attack without any plaque being present. So the 0 CAC score doesn't guarantee you against a heart attack. It just means that you are at much, much lower risk than someone, with higher scores. Now, the score of 250, is that high? How concerned should we be? Understand that these scores, the highest score I've ever seen was around 8,000. So they can get pretty darn high. 200 is about the area where we start saying, okay, there's a possibility that this could indicate that you have a blockage that might be significant. And maybe we should consider something like the CT angiogram to look for that. But honestly, at 250, I'm usually not too worried about it. And what I would want to do is first figure out with that person, why are you forming plaque? Are you insulin resistant? Do you have inflammation? What can we identify that might be causing you to form the plaque? And then, is it getting worse or not? So come back a year later and scan again. If it's still 250, okay, you're probably doing all right. You may have had some damage in the past and things have stabilized. If it's lower, even better. But if it's gone up to 400, we know that there's still active plaque formation there, and we got to figure out why. And that's how, again, we get more aggressive about preventing the disease rather than just waiting it around for someone like that to have a heart attack.
So is there testing that can be done that would diagnose someone with insulin resistance?
Yes, very simple blood testing that can be done. And the easiest way for people to do this is get what's called a fasting insulin level, not your fasting blood sugar level, although you want to know that as well, but don't stop there. You got to ask your doctor for the fasting insulin level. And once you know your fasting insulin level and you know your fasting glucose level, your blood sugar level, you can plug those two numbers. You can go online. You can look up a calculator. It's called the HOMA-IR score, HOMA-IR score. And that will tell you if you're insulin resistant or not. If your fasting insulin level is in the double digits, above 10, you're probably insulin resistant. If you know that you have chronically high blood sugars, if your hemoglobin A1C is above 5.7, you're probably insulin resistant.
I'm so curious because that fasting insulin test actually says that the range goes all the way up to 24.
Yeah, and this is a problem that people, even if they are right? So the first problem is most doctors don't check this test. And the second problem is even if they do, they may be misinterpreting it because of exactly that. A normal level is considered to be upwards of, depending on the lab you're checking it with, 20 or 25. And the reality is that if your fasting insulin level is above 10, there's a high likelihood that you are insulin resistant. And you can do some additional testing to help you figure that out. Again, that HOMA-IR score, calculate that, and that gives you an indication. If it's above 1.5, you're likely insulin resistant. And then you can get another test called an LPIR test. Now, the LPIR test is very interesting. LPIR stands for lipoprotein insulin resistance. So we talked earlier about the quality of cholesterol particles. We talked about the size of the particles. One of the most powerful determinants of the size of your cholesterol particles is insulin resistance. So if we look at the particles, what the LPIR score does is it works backwards. It looks at your particles and it uses those to tell you how insulin resistant you might be. So it's a very interesting test, and it's another one that I oftentimes recommend to people. And then there's the gold standard for diagnosing insulin resistance, which is a little bit less of a practical test to do, but it's what's called a Kraft test after Dr. Joseph Kraft. And basically what you do for this test is you drink glucose, and then you measure both your glucose and your insulin levels every half hour for 2.5 or 3 hours afterwards. So the problem is you got to sit there at the lab for 3 hours. They got to draw your blood every 30 minutes, and it becomes a little bit less practical of a test to do. In reality, for most people, the HOMA-IR and or the LPIR test are going to be enough to tell you if you're insulin resistant or not.
So do you think that there's a lot of insulin resistant people walking around and nobody's testing them?
We know there is, right? I cited that study earlier that said that 93% of the adults in the United States have some, features of metabolic disease. So yes, the answer is there are a lot of people with insulin resistance walking around who have not been tested for it and therefore don't know it.
And it seems like it's not like a normal thing for you to go to the doctor and be like, I'm having all these symptoms, and then just go, maybe we should check you for insulin resistance.
Yeah, unfortunately not. But it turns out that if we look at the top 10 causes of death in the United States every year, 9 out of the 10 of them are directly attributable to insulin resistance. So honestly, I can't figure out why it's not tested for. The only answer is it's because doctors aren't educated about it in the way they should. And it's just not in the standard algorithms that they learn for taking care of people. When it gets to the point of something like type 2 diabetes, right, which is one of the end products of insulin resistance, that's when doctors will start paying attention to it. But unfortunately, by the time it gets to that point, that person has probably been insulin resistant for decades. And there's probably already been significant damage done.
Do you think that insulin resistance is fully reversible, or is there levels of damage?
In most cases, it is fully reversible. We see an occasional person who it's just been there for too long that, we might not be able to reverse it with diet and lifestyle alone. So when we bring in medications on top of diet and lifestyle, I am yet to see a case that couldn't be reversed, but it may take the use of some medications to do that. But that's not the case for most people. For most people, if you're insulin resistant, if you make the diet and lifestyle changes, you drastically lower or eliminate completely carbohydrates, you get some more activity, you make sure you're sleeping okay, you deal with the stress in your life, and you get some sun on a somewhat regular basis, insulin resistance is almost always going to reverse when you do those things. Now, you got to do those things, right? And a lot of people aren't willing or to do those things. But honestly, when I see patients and I say, listen, you can do those things that I just said, you can reverse your insulin resistance and you can get back to leading a healthy life without the need for medications, or we can put you on medications. You're going to need more and more medications over time. Despite those medications, you're going to start to develop complications of this, right? You're going to get heart disease. You're going to get cancer. You're going to get Alzheimer's disease. You're going to get diabetes, whatever, pick one of these things or multiple of these things that you're going to end up with. And you can, you can do that and not make the lifestyle changes. I am yet to have a patient that says, sign me up for the medication and the progressive decline in my life, right? They all like, okay, tell me what I need to do to change my diet and lifestyle. Now, I don't want to make it sound like, that's an easy thing to do. I understand the challenge of doing that. The concept is easy. Putting it into practice is not. And that's where we need to be there to support this person. And, in my practice, I have some amazing health coaches that work with me so they can do the work with the patients, on a daily and weekly basis to help them do this. And, again, the vast majority of the time, the patient does it, they get the results, they see those results, and that becomes self-reinforcing. And like I said, yes, people fall off the wagon and it might take a couple of false starts before it really kicks in. But when they understand the option, right, end up on my operating table or, change the way that you eat and live, again, the vast majority of people, they're going to change the way that they eat and live.
Yeah, that's absolutely true. So you said something earlier about how meat is nutrient dense and how basically meat is medicine. What about vegans and what is happening to them when they have something like heart disease or multiple heart problems and they had a heart attack and then went vegan? What does that do?
Yeah, it depends, right? So the thing is that, we'll call it a whole food plant-based diet, right? That can be an improvement in their nutrition, right? In their well-being when you compare it to the standard Western diet. And that's what the studies have shown us, right? When you compare a vegan diet to a standard Western diet and you eliminate the processed food, right? Then you can see health benefits from that. Now, there are some things that you may not see benefit from, right? Because unfortunately today, right, there is so much what I call junk, vegan junk food, overly processed food. And no, it doesn't contain anything from meat. So everyone thinks it's healthy, but it is nowhere near healthy. And that can be a problem. Right? We always point out, right, that Oreos are vegan. And if you eat a bunch of Oreos, you're not going to end up healthier. So, but the real problem becomes long-term. You cannot get the nutrients that you need from eating plants alone. And this isn't debatable. Even the vegan advocates will say, admit this. And they say, well, but you can supplement. And you need to understand supplementing is not the same thing as getting it from the food. And the other problem is that the forms of many of these nutrients and vitamins that are in the plants are not the forms that we use as human beings, as animals. Our bodies are built to optimally utilize animal plant-based nutrition. And when you look at meat, especially ruminant animal meat, beef and, other ruminant animals, the nutrients are the most dense within it, and they are the most bioavailable to us. Our bodies are optimized to extract those nutrients. The nutrients that are in a lot of these plants are not available to us. Our bodies can't extract them, and they end up with a lot of waste product, essentially. And so that becomes the challenge of, if you're going to do a plant-based diet, you simply cannot get the nutrients that you need. And we can talk about lots of different ones, right? Whether we're talking about the different proteins and the specific amino acids that our bodies needs, when we're talking about things like B vitamins, when we're talking about things like heme iron, right, that just are not available from plants. And therefore, I do not believe that a vegan diet is compatible with good human health.
So, in light of all of that you said, can someone with heart disease or multiple heart problems reverse that if they took all of the processed things out of their diet instead of just taking the meat out of their diet? What if they went with meat and they cut all those things out? Could they help their heart to heal?
Yes. What I tell people is we can stop it from getting worse, right? We can remove the things that are causing the damage. We can stop it from getting worse. And then we give our bodies a chance to heal. And like I said, the body has an amazing capacity to heal. So meat, like I said, is medicine. Meat is essential to health, and we provide our bodies with the nutrients that it is looking for in their most bioavailable form. And that is how we can now create an environment in which the body will start to heal. And I've seen some pretty impressive things happen with that. I've seen people come to me with advanced heart failure. I have one lady who came to me and she was told that she was going to need a heart transplant, and was on, had been in the hospital for, a long period of time, came out of the hospital. She was on like 8 or 9 medications, and she was told that she was going to need a transplant pretty soon. And she went on a carnivore diet. She eliminated processed food, and within about 4 months, we had her off of her medications, and her heart function had improved significantly. And then ultimately, over about the course of a year, her heart function returned to normal. So the body can heal. I've seen people with advanced atherosclerotic heart disease that, the plaque stops getting worse, and we start to see some reversal, and their functional capacity improves, right? The body's ability to deal with the blockages improved. And so they're able to do all the things they want to do in day-to-day life. They're able to be active. They're able to exercise without any sort of symptoms. And therefore, they haven't needed the stent, or they haven't needed the bypass surgery that they were told they were going to need. So the body certainly can heal. The blood vessels can heal, and we can start to stop the progression and then reverse the process of atherosclerotic heart disease.
That's amazing. Is carnivore safe long term?
Yes.
That was an easy
Doesn't
answer.
need explanation. The answer is yes. I mean, and again, whether you want to go through the ancestral record that, carnivore was our long-term diet, or, you want to look at modern examples, and we can point to many long-term carnivores who are showing amazing health. And the bottom line is there's nothing harmful within the carnivore diet. So, yes, it's going to be a good long-term diet. It's a good short-term elimination diet, and sometimes that's the way that we use it. And it's a good long-term diet. And listen, that doesn't mean that everyone needs to be 100% pure carnivore for the rest of their life. Most people, the answer is you should be kind of, maybe what we call animal-based. If you want a little bit of other stuff, again, once you're metabolically healthy, you can tolerate some other stuff. Now, you don't need it if you want to be 100% carnivore, because a lot of people, once they start doing carnivore, they just figure out, A, that's how they feel best, and B, it's just a simpler way to live, right? You don't have to think about all the different combinations of what I'm going to eat. I just, I eat some meat and I'm happy. And when I get hungry again, I eat some more meat. right? And and in that sense, it ends up being a very simple and very appealing lifestyle for a lot of people. But I'm not, and I know there are some in our community that are very dogmatic, and they, tell you that you should never eat anything that's not carnivore. And I think for most people, that's not true. For some people, it is true. There are people with significant autoimmune problems that, if they eat anything non-carnivore, they're going to have trouble. And those people, they should be strict carnivore, and they should feel, liberated to be strict carnivore, because it's not going to harm your heart. And it's not going to harm your overall health long term.
Exactly. For midlife women, this is my audience. They've been told to eat less, move more, and it's perimenopause, menopause, or just aging. And they think that weight loss is the real fix. But is weight loss the fix, or is it adopting a lifestyle that removes most of the things that cause the problems, and then prioritizing nutrient-dense food?
Yeah, weight loss is the side effect of getting healthy, I tell people, and that should be your focus. So focus on getting metabolically healthy. The weight loss will happen. Now, admittedly, middle-aged, perimenopausal, menopausal women, they are the most challenging to deal with on this front, because those hormonal changes, those have to be kind of reckoned with as well. And maybe that is doing something like bioidentical hormone replacement. But again, I have seen many examples where, adopting a low carb, non-processed, maybe carnivore, maybe keto type diet can greatly improve the consequences of the hormonal shifts that are occurring. But, I do kind of encourage people that weight loss shouldn't be your main focus, right? Weight loss should be the side effect of getting healthy ultimately.
That's exactly what I tell my audience. The other thing that I tell them is a lot of the problems is when you eat all of these foods that are causing issues, it's like chaos in the body. And they find that when they go carnivore and they stay with it, they actually feel better, because it was like interference from all of the processed and moderated foods that they try to eat.
Yeah, I mean, I think ultimately that is, and again, it's not the only thing causing us trouble in our environment, but it's the big thing. And it's the thing that we have control over. Right? We control what goes in our mouths. And if we make some different choices, we can see some great effects just from doing that.
So I have 3 quick questions. This is what I do with most people that are on the podcast. What's one thing you wish you'd have known when you started carnivore?
I guess one thing I wish I had known when I started carnivore, I wish I had known that it was going to be, that it was going to be so easy to maintain, I guess is the way that I would say it. I thought that eliminating all of this stuff would be so challenging. But in reality, again, when you see the effects of it, right? The reason that I don't go back to eating much of the other stuff is not because I fear that the other stuff is damaging my health. It's because I realize the benefits of eating all of this meat. And so that's what I primarily want to eat. And, most people come at it thinking the other way, right? They think about what they're pulling out. And instead, you should be thinking about all of the nutrient-dense, bioavailable food that you are feeding yourself.
Exactly. Now, what's one thing you can share with my audience that may help them on their journey to carnivore or to stay with carnivore?
Yeah, I think the best thing that I can share as a heart surgeon, again, is saying that meat is medicine, and it is not harmful to your health, and it is beneficial to your health.
Thank you. So where can we find you and look at your work and your books?
Yeah, so the new book, Stay Off My Kitchen Table, widely available, all the usual places. And then to find out everything that I'm up to, you can go to ifixhearts.com. You can find out about my medical practice nationwide, telemedicine practice. I am licensed in all 50 states, plus Washington, D.C. I see international patients as well. I have an amazing team there, nurse practitioner, 5 health coaches, all the behind the scenes people that are just absolutely amazing. And we're available to help. And, it's not just about the heart disease. It's about metabolic disease in general. So iFix Hearts, you can find out about that at the website and then on all the social medias at iFix Hearts. parts as well.
Okay, awesome. Well, thank you so much for being here. I will see you at Hack Your Health and Meat Stock. So I will be there. And I really appreciate you and your expertise today.
Thank you, Cristina.
Your body isn't working against you. It's trying to tell you something. If you're ready to better understand those signals, keep learning by watching this next video. Subscribe and join me every Wednesday. I'll see you in the next video.